Decay is one of the most common diseases in the world, and if left unchecked, can lead to extensive breakdown of the tooth and potential loss. To prevent further decay of the tooth and restore that which has been destroyed, your dentist may choose to place a bonded indirect restoration known as an inlay. This procedure begins with removal of the decayed tooth structure. The dentist will also follow specific preparation guidelines to accommodate the inlay restoration. Next, an impression is taken of the prepared tooth. Once the impression is completed, a temporary filling is used to seal the inlay in place. The impression is then sent to a dental lab for custom fabrication of the inlay. The inlay may be fabricated of either composite material or ceramic, a choice that will depend on the location of the inlay. Upon return from the lab, the temporary inlay is removed. The tooth is then prepared with a cleaning agent and an adhesive agent that is used to bond the adhesive cement to the inlay. This cleaning agent is rinsed off, and then the adhesive bonding agent is applied. This adhesive is then cured with blue light so that it hardened. The blue light waves have energy required to polymerize the bonding agent. A resin cement is then applied to the underside of the inlay and placed onto the tooth preparation. Excess cement is removed with a small brush. The curing light is then used to harden the cement and bond the inlay to the tooth. Inlays are not only highly aesthetic and a good choice for larger restorations, but also offer greater strength and hardness than regular fillings.